Good day everyone, I am Creziel Pojas from BSN-2A, and at this time I will be performing male urinary catheterization. So first, what is catheterization? So it is an introduction to catheter through urethra to the bladder for instilling or removing of fluids. So some of the purpose of catheterization is that to relieve urinary retention, to control urinary incontinence, and also to obtain um, sterile urinary specimen. So, first thing first, I will be checking my patient's chart and also the doctor's order. So, I have here patient number 808. His name is Michael Brown. His medical record number is 074116. His date of birth is December 19, 1999. And the doctor order for insertion of Foley catheter because the patient is unable to void 7 hours post-op. So I will be also checking for some allergies with my patient regarding on betadine or iodine or latex products. So far in the chart, the record has no allergies regarding on those aforementioned products. So now, I will wash my hands before the procedure. I will sanitize. Next, I have my equipments here needed in the procedure. So the most important thing is the catheter, which is the expiration date is January 2025. And the size of the catheter is 16 to 18 French, which is appropriate for male. And I have also the urine bag, the forceps, the plaster, the 5cc distilled water, and the lubricant, and all the gloves. So that's good, and that's all for the equipment. So now I will provide privacy for my patient before we will proceed to the procedure. So I will be closing all the doors and windows. So I've already closed the doors, and there is no more opening areas that could trigger or that could ruin the privacy of the patient. So I've already produced good lighting. So now I will interview first and introduce myself to my patient. Good day, Mr. Brown. By the way, I am Creziel Pojas, your nurse for today. So, what is your last name again and your first name? Uh-huh. So, I have a record here. So, um, what is your date of birth? December 7, 1999. Okay, thank you. So, your medical record number, I will be also checking. I will just make sure that it is right. Okay. It is right. And now I will questioning you about any allergies. So, do you have any allergies regarding with betadine, iodine, and latex products? Okay. None. Thank you. So I have questions. So when was the last time you urinated? Last night. So by the way, the doctor ordered for insertion of catheter because you were not able to void 7 hours post-op. So by the way, this procedure is a little bit long, but I know you can handle it, and I will be inserting tubing in your urethra to your bladder to remove and drain those fluids in there. So, do you have any questions before we will proceed? Okay, good question. So, this is a quietly painful, but I know you can manage it. And I just want you to take a couple of breaths. Okay? Okay, thank you. So now, I will be using the glove. So, I will be performing perineal care for my patient using my gloves to prevent contamination. So, I will be cleaning my patient's urethral opening to the glands. So, I will be removing this blanket. So I will be cleaning it 3 times. Circular motion. 1, 2, and 3. So now I will dispose my gloves because it's already contaminated and it's already unsafe to use. Okay. So now I will position the patient into a supine position and I will attach the eye sheet in order to provide more privacy with the patient. Supine position. Now I will attach the eye sheet. So the eye sheet helps to expose only the urethral opening to provide more privacy. So now I will be putting this tray in the perineal area. And I will also prepare 2 cotton balls with betadine that can be used later for disinfection. So using the forceps, I will get 2 cotton balls with betadine. So now I will put the sterile gloves. Okay. After that, I will place the waterproof underpad in below the buttocks of the patient to support and to avoid some moisture later for the water. So I will dispose it. Okay. So after that, I will insert the catheter into the urine bag and also I will attach the 5 cc distilled water into the container or into the balloon port rather. So make sure that the syringe is attached well in the balloon port. Okay, so I think it's attached well already. So now using this one, I will use lubricant and spray it at the tip of the catheter for about 3 to 4 inches. Okay, sit it in there. So using my dominant hand and my non-dominant hand, I will disinfect the urethral opening or the meatus of the penis so that we will undergo the disinfection. So from glands, from the urethral opening to the glands. 1. With the dry sheet. now I've already disinfected the rectal opening. So now I will insert the catheter tip for about 7 to 9 inches. So Mr. Brown, I will now insert the catheter tip, and it takes a little quiet time. So I want you to breathe deeply, okay? Okay, thank you. So now, with about 7 to 9 inches, I will now insert the catheter. Okay, please breathe deeply, Mr. Brown. Okay. Okay. Inhale, exhale. Okay. So now I will push the 5 cc distilled water slowly. Okay, thank you. How are you, Mr. Brown? Oh, good to know that you're good. Okay. Now I will remove these this syringe and dispose it. Now I will remove the drape. I will get my equipment. Now using the plaster, I will attach the hose into the thigh of the patient. So okay. And I will put this urine bag into the hook. Okay. So before you leave the room of the patient, make sure that the patient is comfortable. So I will be removing this waterproof underpad. And put this blanket again. So are you already good right there, Mr. Brown? Okay, thank you. So now I will be removing my gloves because it's unsafe because it is already contaminated. So now I will sanitize my hand again. So the summary of the procedure for male catheterization. So the patient is Michael Brown. So his urine output. So the amount of urine that is drained is 500 ml. The time of the procedure is 20 minutes. The color and the description of his urine is light yellow, and the reaction of the patient is normal. So that could be all. Thank you.